डॉक्टर राजकुमार भारतीय एमडी, मैंने उनसे इनको दिखाया। उन्होंने एक सप्ताह एक करके इनको नॉर्मलाइज करके डॉक्टर रोशन अग्रवाल अपोलो हॉस्पिटल, उनको उन्होंने रेफर किया। और उनके रोशन अग्रवाल, मुकेश अग्रवाल, केलकर और प्रदीप हाथीमोथा, पांचों का देख रेख में जो भी इनका ट्रीटमेंट हुआ उससे हम लोग सर्टिफाइड हैं। और हमारा पेशेंट जो है वो ठीक है, कोई दिक्कत अभी नहीं है। डॉक्टर प्रदीप हाथीमोथा ने जो इनका बाईपास सर्जरी किया उससे इनको रिलीफ मिला। और डॉक्टर रोशन अग्रवाल ने जो मेडिसिन या जो भी उन्होंने अपना ये हुआ, जितना बन पड़ा उन्होंने अपना किया इनके लिए, उससे हम लोग ये है, हमारा पेशेंट भी ठीक है, हम भी सर्टिफाइड।
We have this patient, a 45-year-old gentleman, who presented to us with his known case of cirrhosis of liver and had accumulation of water in his abdomen, which we call ascites. And this time he was being managed at multiple places, and this time he presented to me with shortness of breath, means difficulty in having his breath. And we evaluated the patient and we found that he was having cirrhosis of liver with portal hypertension, with accumulation of water in his abdomen called ascites, and also accumulation of water in his chest on the right side, which we call hydrothorax. So that was leading to his difficulty in breathing. Was in severe distress, was admitted to ICU. We tried to manage him with medicines, and with medicines he was slightly better, but his symptoms was persistent, and we needed to drain out water from his abdomen. We drained around 5 liters 2-3 times in a span of 1 week, and also we drained water from his chest around 1 liter 2-3 times.
This particular patient was sent to us by our gastroenterologist for special procedure called Transjugular Intrahepatic Portosystemic Shunt. This is one of the complex and very special procedure of interventional radiology. In this procedure, what we do, we puncture the jugular vein under ultrasound guidance. Then we put a long sheet in the hepatic vein. We take the hepatic venogram. Then we puncture the portal vein through the right hepatic vein and create a shunt. First we put a extra step guide wire from the right hepatic vein to the portal vein. Then we put a catheter to the portal vein and take a good venogram, so that both the hepatic vein and the portal vein are opacified with contrast. Then we dilate the tract with a long balloon, and after the dilatation we put 2 stents. One is covered stent, that is in the parenchymal portion of the shunt, and we put a long uncovered stent between the portal vein and the hepatic vein. Then this is the procedure what we do. After the procedure we take the venous pressure. That pressure gradient should be less than 20 millimeter. So this procedure was successful. Patient is doing very well. His ascites and hydrothorax has significantly decreased, and there is no fresh accumulation of fluid.
Chest. So for this type of conditions, there are 2-3 options we can offer to the patient. So one is the conservative therapy, where we do give some medications to move the fluid from the body. For that we use diuretics. Then other options, repeated therapeutic tappings. So we take out fluid from the abdomen and the chest. And the third option, and the final option, that is the curative option, that is the liver transplant. And apart from these modalities of the treatment, another modality that is called the TIPS. So which is a radiological procedure which can be done for the bridging of this bridging to the transplantation. So we offered this procedure for this patient, and these procedures can be done for other indications, including refractory gastrointestinal bleed due to cirrhosis of the liver and portal hypertension, and in some cases of renal failure which is not responding to normal therapy. So basically portal hypertension cases required these modalities of the treatment, and we offer this therapy for this patient.
The patient actually requires liver transplant, but the liver transplant is a major undertaking and takes some arrangements to be made, and patient usually needs some time. So this TIPS procedure has given the patient a good relief. His symptoms have gone down, his ascites accumulation has disappeared, and his fluid in the chest has also come down. His medications are less now, and there is no any complication that we have noticed till the patient came to us for follow-up after 1 week. His medications have also gone down. Now patient will finally require liver transplant, but he will get some time to make his arrangements. I think this is a very good and important procedure, complex procedure, which has helped our patients tremendously.